Welcome to the Bike and Mess Historic New Bern Ride Medical Volunteer Training. My name is Paula Lipford and I'm the Director of Volunteer Engagement for the Greater Carolinas chapter of the National Multiple Sclerosis Society. I will be leading the training along with Dr. Scott Playford, who's a physician with Onslow Primary Care and Sports Medicine. Dr. Playford, whose call sign on the route is Doc 1, has been volunteering with us for a number of years. You'll be hearing a lot more from him later on in the training, and you will have the opportunity to get to know him as he visits the rest stops along the route. I first want to just take this opportunity to thank you for volunteering. You play such a key role in ensuring the safety of our participants and volunteers, and we really could not put on this event without you. Bike and Mess in New Bern is one of the largest events in the Southeast and has been located in New Bern for many years. The event is a 2-day cycling event which starts and finishes each day at Union Point Park in New Bern. There are route options for all levels of cyclists. On Saturday we have a 25-mile very scenic route. On Sunday we will have a 30-mile route. And then both days will have a 50, 75, and 100-mile route options. There are rest stops that are located every 8 to 12 miles, and Bike and Mess provides a fully supported ride. The rest stops supply water, Gatorade, and snacks, and of course we'll have medical support located there and bike mechanics. Lunch is served to the participants and the volunteers on the route each day at one of the rest stops. So please be aware that if you are volunteering over the lunch hour, a lunch will be delivered to the rest stop for you. We expect to have approximately 2,000 cyclists participating each day. The cyclists who are participating in the event must be 12 years old or older. You will note that many may be very highly trained, and some are athletes, but some are not. Some are people who are novice riders or who are not well-trained athletes. Also, be aware that they don't always follow directions, and some may ride with health issues like diabetes. Some may be pregnant, and several will be riding with MS. In fact, we have some cyclists who will be riding with I Ride with MS jerseys. So be on the lookout for those and be aware that there are a number of different issues that you might come into contact with. We have a lot of emergency support along the route. There will be 2 or more medics stationed at each rest stop and at Union Point Park. On the route, we will have 3 mobile emergency response team members who ride motorcycles and are ham radio operators. Doc 1 will be on the route. We will have SAGs. We will have people who are called super SAGs, and I'll explain more about them in a minute. We also have county emergency management services, fire departments, and rescue squads, and some of our rest stops will have ambulances on standby, and we'll have the support of our police and state troopers. Our communication team is really led by our ham radio operators or amateur radio operators who are stationed at each rest stop. We also have a net control or a group of hams who manage all of the communication, and they are located at Union Point Park. Hams serve also as support and gear or SAG drivers on the route, and those SAG drivers are available to pick up cyclists who are in need and transport them to the next rest stop. One of the keys to being a medical volunteer at a rest stop is the first thing you need to do is make sure you meet and make friends with the ham, because the ham is your link to all of our emergency communication. And please remember that in any emergency situation, tell your ham. As I mentioned, we have motomedics or mobile emergency response team members on the route. Motomedic 1 is Dr. Bill Price. He is an associate professor of emergency medicine and works at ECU. We have Motomedic 2, Hyman Denby, who's an EMT, an RN, a paramedic, and a firefighter. And then we have Motomedic 3, Jay Oswald, who is an emergency medicine PA. They ride the route and are equipped with ham communication and are part of that emergency communication team. As I mentioned, Dr. Playford is our Doc 1 on the route. Dr. Playford is usually assisted by a nurse or an EMT, and he rides the route and checks in with our rest stop medics. So if you have a question or a concern, he is available to answer those for you. He's also available for a consult, as are our motomedics. Should you have a question or should you have an emergency and you would like some additional advice on dealing with the emergency. Dr. Playford may or may not have a ham with him, but he will be directed by net control. So should you need a consult and you want to communicate that to your ham, our net control will communicate directly with Dr. Playford and communicate your question to him. As I mentioned, we have SAG vehicles and super SAG vehicles on the route. SAG vehicles are support and gear vehicles driven by hams. They might be the ham radio operator's personal vehicle or one that is owned by or rented by the society. And they patrol the route. What they do is if a cyclist is unable to continue or it has a difficulty or problem, that SAG will pick the cyclist up and take them to the next rest stop. They act as our eyes and ears along the route. If a cyclist has had a flat tire or is having a problem with their bike or is feeling has a difficulty along the route, they know to signal the SAG drivers as they pass by. And SAG drivers are directed by a central SAG driver named SAG 1, who knows where the SAGs are along the route and will direct them to move on to different rest stops and different zones within the routes. Super SAG vehicles are 2 15-passenger vans and 2 buses, and they are usually located directly at the lunch rest stop. The 2 15-passenger vans wait until there are enough people who need to go back directly to the start-finish line, and they will transport people who are done for the day back to the start-finish. Our 2 buses are stationed at lunch for the purposes of evacuation should there be bad weather and should we need to get cyclists off the route quickly. Now, Dr. Playford is going to give you more information about your job as a medic.
Okay, thank you. And let me also say thank you to all of the volunteers and welcome back to the people who've helped before and welcome to the new people who come. This is a great event. I've had a lot of fun doing it. It's very well organized and very well supported, so I think you'll enjoy it. As far as the job descriptions go, for the medics, when you get to the site, make sure that the tent's set up if it hasn't been already. Go ahead and look over your supplies. Look through your handbook, look at your crisis plan, look through your med kit, and be familiar with what's there. You'll find that there's a list of what should be in the supply kit. You'll find the incident injury report forms and the refusal of medical assistance forms. There's no blood pressure cuffs or anything like that, so if you want to bring one, that certainly would be helpful. There's often times where we'll want to set people down and check that. Also, there's going to be a consumption of medical product disclaimer. Make sure you post that. In general, the medics are not to administer any medications. If the riders choose to take that themselves, that's on them, and we need to make sure that that disclaimer is posted. Introduce yourself to the rest stop captain and also to the ham radio operator. As Paula said, that ham radio operator is your connection to everybody else in that circuit. You're going to want to watch and mingle. Basically, observe the riders as they come in. Look and see how they're acting. Go and talk to them. Mingle with the other helpers so that they know who you are. If they see a rider in distress, they can come and find you. Help out make sure that there's Gatorade available. Make sure that the riders are getting hydrated. If you see somebody who looks like they're sweating a lot, point them over towards where the Gatorade and the water are located. See how they're acting. Are they responding to you? Are they still smiling? Most of them will be smiling at the first couple rest stops, but not necessarily at the later rest stops. And then, if they have that look of distress, ask them some questions. How are you feeling? How much are you drinking? When was the last time you had to urinate? And that way you might be able to pick up some riders who need a little bit more assistance. And then assist with minor injuries. There's going to be scrapes. There's going to be scrapes from the pedals, road rash. So minor injuries, there should be some supplies there that you can assist with that. For the significant injuries, make sure you fill out an accident injury report. Those are going to be in your med kit, and they're going to be located in the handbook. Try to get as much information as you can to complete those, because that is useful for tracking purposes. The other thing is, if you see a rider who you recommend treatment or you recommend that they be assessed and they refuse, make sure you try to complete one of the refusal of medical assistance forms. Get as much information as you can, at least a rider number if nothing else, so that we can note that and possibly monitor them later in the route if we at least know their bib number. All the medics at the rest stops should stay where they are until they're relieved. It's vitally important that we make sure that each rest stop is covered. So please try to stay on station, and the next replacement should be there on time. If they're running a little late, please stay until your relief comes. Do not go and take another assignment. Do not go off-site unless you are assigned to go somewhere else or you notify the crisis director. As far as what decisions you can make, if you feel that a rider is in danger of hurting themselves, if you feel that they're compromised, if you feel that they're in distress, you can make a decision that they should not continue. If there's any question about that, the easiest thing is to get your ham operator to call either myself or one of the moto medics to come, and we'll be the bad person if we need to. But you do have the right to stop them and say, no, we want you to wait for the medic to get here. If they refuse, then fill out one of the forms, get their bib number, and make sure and notify net control so that we can keep an eye on them. You can make a recommendation that they get sagged or that they move ahead. And you can suggest, you don't have to quit, but why don't you get sagged to the next rest stop, and by then you'll have some time to recover and be ready to go. If they look dehydrated, if they tell you that they haven't gone to the bathroom in a while, you can stop them and say, no, I want you to sit here and drink some Gatorade, drink some water until you go and urinate, and then you can go and continue. And you just kind of see on their face whether they really are done for the day. A lot of times you can tell by how they're acting and how they're carrying themselves. But if there's somebody who really is arguing with you or insisting to continue when you don't think it's safe, have the ham operators call Doc 1 or Moto Medic, and we can come there, because odds are we're going to be right around where the pack is, and we can come and make that decision. In your medical kit, you'll see the big bin with the Red Cross. You're going to have some basic supplies, some gauze and bandages, Band-Aids, ace wraps, scissors. There's going to be a limited supply of certain things like the BioFreeze and the medications. Again, the medics, the volunteers, will not be passing out any of those medications. They are there available for the riders to self-medicate if they choose, but make sure that you have that disclaimer posted so that we're not prescribing anything. And also, you might want to reserve some of the supplies, because the cyclists are going to go through the kit. When they come, they're going to be tired. They're just going to try to rifle through and find what they want. So you may want to reserve some of the medicines, or reserve some of the bandages on the side, and put them out in small quantities as the riders come so that you don't run out. There's going to be mustard packets at the stops for cramping, and some salt tablets and other supplies such as that. And most of those, what you have is what you're going to get. There's certain essentials that we may be able to resupply. Let net control know if you're running low on certain things, but other things we have limited supplies of, so you try to ration those out. Road rash, you're going to see a lot of that, minor scuffs, and some that are a little bit more significant. If it's small, if it's minor, clean it, dress it, and they can continue. Ask to check their equipment, check their helmet. If they had a fall, look at their helmet. Is it scraped or is it cracked? If it's cracked, they will not continue. They are not allowed to continue with a cracked helmet. There's gloves in the kit. But if there's something more significant, a more significant road rash that you don't feel comfortable with, call Doc 1 or call Motomedic, and we'll be more than happy to come and take a look and see whether it's something for them that's safe for them to continue with. Heat exhaustion is another thing that we need to be very aware of. Dehydration and heat exhaustion may go hand in hand, but you may still get heat exhaustion even if they're drinking. If you look at page 11 and 12 of the Crisis Handbook, you'll see more information about this. But if they're coming in and they're looking more confused, they're having cramping, nausea, fatigue, dizziness, pale, profuse sweating, rapid heartbeat, if they look like they're fainting, if they're describing dark-colored urine, that's somebody that we need to take care of quickly. Get them out of the heat, get them out of the direct sun. Put them in the shade, get them in a car with the air conditioner on. If you're at one of the locations where you can go inside, get them inside where they can be cooled down quickly. Put some ice on their neck, their armpits, their groin. That will cool their core temperature quickly. Get them something cool to drink. And call, if it's an emergency where they're obviously distressed, call 911. You're going to notify the ham operator. Ham operator will notify net control and call 911. If they just seem like they're in some distress, but it's not an emergency, call Doc 1, call Motomedic. And again, this is why you want to be good friends with that ham operator, because they're the ones who can get us quickly. And you do have the right to ask the rider to stop and wait for us to get there. Dehydration is another common problem, so keep reminding them to drink. Make sure that they're not just drinking water the whole time. They do need to replace electrolytes as well, so they need to eat some snacks. They need to drink some Gatorade or have some of the salt tablets, because overhydration with water can also be dangerous by lowering the sodium too much. But ask them how they're feeling. Ask them if they're going to the bathroom regularly. Ask them how much they've been drinking since their last rest stop.
Thank you, Dr. Playford. And now I want to just give you a few more points about our crisis communication plan. As I mentioned previously, our primary means of communication will be through our ham radio operators. There is an emergency cell phone held by Net Control, and this number will be in your crisis manual. And it has been given to our cyclists, so if they have a problem on the route and need to get in touch with Net Control, they can call them with their cell. I also want to remind you that we always identify our cyclists by their rider number on their bibs. We want to protect the privacy of those who are injured, and we only refer to our cyclists by bib number. And remember, too, that we operate on a need-to-know basis. We don't discuss the injuries or problems or incidents with anyone else who does not need to know. The closest hospital for the entire route is Carolina East Hospital, and that's where any transports will be taken. Remember that if you feel it's necessary and the situation warrants it, call 911. But be sure you also tell your ham to notify Net Control so that all of the staff and people on the route are fully aware of what's going on. The closest mobile medic will also be called, and then we'll have really the final decision on medical issues on the route. When there is an incident or an injury, the first medic on the scene is in charge of that medical emergency until medical personnel with a higher authority arrives on the scene. The process is then that first medic will then release the patient into care of the new medic once they feel like that medic has all the information that they've obtained. And the first medic will then verbally release the patient to the new medic. So our crisis communication at the rest stop, it's really important that you're monitoring and responding to cyclists in need, and then you're advising the ham to notify Net Control if there is further care is deemed necessary. So if there needs to be a transport, Someone needs to be sagged back to start finish. And then, as I mentioned, if an emergency situation arises, call 911 and advise the ham to notify net control and the closest mobile medic. And if you are concerned about a cyclist continuing, please advise the ham to notify net control and request one of our medics to come and give you a consultation. Also be aware that the official spokesperson for the event will be listed in your crisis manual. The official spokesperson is the only person who can comment on any transports, any injuries, any incidents. Do not share any information or try to answer any questions about the incident, serious or otherwise, to anyone except the police and net control. Don't share information about any situations with anyone, even after that situation has been resolved. It's really important that we don't speculate or give our opinion about something. And if you're asked about an emergency situation, please reply, "I'm a volunteer." You will have to ask the media spokesperson on staff. Also be aware that sometimes we have news media who want to ask questions about previous events. Perhaps something has happened and an incident's happened in a previous event. If that happens, please give that same answer. "I'm a volunteer." You'll have to ask the media spokesperson on staff. A word about confidentiality. There will be some cyclists who are wearing the I Ride with MS jerseys. And we just want to make sure that we don't take an opportunity when we see someone wearing the I Ride with MS jersey to assume that this person is willing to disclose their status of having MS with just anybody. So when you see someone, always take the lead from that person and don't discuss it outside of the event. Say you are back at the Saturday evening event and you see that person and you know them and you have a mutual friend and you say, "Oh, I didn't know so-and-so had MS." Obviously, we want to be careful to protect the confidentiality of our participants, and so please just refrain from doing that. And lastly, I want to ask you to just make note of my email address and my phone number. And if you have any questions after the training, please contact me by email or phone. And I can pass any clinical questions or anything that needs to be passed to Dr. Playford. And I might be able to answer those questions myself. And please, if you are unable to fulfill your assignment for any reason or at any time, please email me. I will have my email available while we're at the event, and it would be really helpful so that we can redirect someone else to fill your position. Again, thank you so much for sharing your expertise and your medical knowledge with us. You play such a valuable role, and we appreciate all that you do. Thank you.